Hello, my name is Nathan Messine. Today I'm going to be giving an overview of my Capstone project I've been working on in this course. I feel like this project really demonstrates everything I learned in the program, shows my growth, and it shows that I'm prepared for a future career. For my topic, I did clinical decision support tool for hypertension misdiagnosis. So the reason I chose this topic was hypertension runs in my family, and it's a big issue. And a little bit of a background is hypertension is a very common chronic condition, and people with hypertension are at a major risk for cardiovascular disease. One term I came to know in this program was white coat hypertension. It's something I really already knew about. It's when you go into a clinical setting and you get nervous, you see a doctor in a white coat, and your blood pressure goes higher than what it actually is. So I thought it'd be interesting to see if a clinical decision support tool can help in identifying when this is occurring, and yeah, it can help prevent things like unnecessary treatment, prescription diagnosis when a patient really doesn't need the prescription, and there's also unnecessary long-term care that will go into it if a person who doesn't have hypertension is diagnosed. So for purpose. The purpose is to develop a clinical decision support framework that helps with primary care providers to reduce hypertension misdiagnosis. This project primarily focuses on diagnostic accuracy. It's going to use repeated office readings and ambulatory blood pressure monitoring or home blood pressure monitoring to really try to assist the clinician in making better decisions in the workflow and overall improve patient outcomes. So for project approach, the project approach is using a health informatics system design to create a workflow-based CDS model. This CDS tool will review blood pressure readings across multiple visits. It will analyze trends over time, and it will flag repeated elevated blood pressure readings. Um, the tool is designed to integrate into the electronic health record. There's a chart I created which kind of shows where in the workflow the CDS tool will be integrated. So I feel like it does have potential to help reduce the diagnostic errors in hypertension misdiagnosis. So outcomes. There are multiple expected outcomes of the project. The main one is to improve hypertension diagnostic accuracy. Another goal is to reduce the risk of overtreatment, like I mentioned. And finally, enhance provider workflow efficiency. For discussions. So the findings of the project, they support the idea that a CDS tool in primary care workflows will be valuable. And in this case, for hypertension, it can make a difference. Like I mentioned, different methods like using longitudinal patient data, home blood pressure monitoring, they can help reduce the cognitive burden on clinicians. And also by trying to conquer the problem of white coat hypertension, that can be a really big accomplishment if the CDS tool is implemented. So next steps and opportunities. So for future opportunities, so this CDS tool I'm working on, it is not really actually being implemented into a electronic health record in the moment, like a real life clinical workflow. So it's just theoretical. So maybe in the future there can be a real testing in a primary care environment. And through this testing, there can also be like usability testing with clinicians and a real integration into a EHR platform. And with all the stuff with AI that's happening right now, it could be beneficial and interesting to see how AI can be incorporated into the CDS tool, and it could really make a difference in the workflow. Finally, if in the future, if the CDS tool is evaluated in a real workflow, we can see patient outcomes after implementation. So thank you. That's it.